Understanding Attention Deficit Hyperactivity Disorder, ADHD. Attention Deficit Hyperactivity Disorder, or ADHD, is a neurodevelopmental disorder. It affects individuals' ability to focus, control impulses, and manage hyperactivity. It is one of the most common mental health disorders, particularly diagnosed during childhood, though it can persist into adolescence and adulthood. The symptoms and their severity can vary widely from person to person, making the disorder complex and often misunderstood. Historical perspective. ADHD, though increasingly recognized in modern psychology and psychiatry, has been described in literature as early as the 18th century. The formalization of the condition came in the 20th century, and it has since been refined through ongoing research. The American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders (DSM) provides criteria for diagnosing ADHD, and it has evolved across successive editions to reflect growing knowledge of the disorder. Symptoms of ADHD. The core symptoms of ADHD can be divided into two broad categories: inattention and hyperactivity impulsivity. For a diagnosis, a person must exhibit symptoms from either or both categories for at least 6 months in a way that is inappropriate for their developmental level and causes difficulties in social, academic, or occupational functioning. Inattention in ADHD. Difficulty in sustaining attention during tasks or play activities. Frequent careless mistakes and overlooking details in work or activities. Seeming not to listen when spoken to directly. Frequent failure to follow through on instructions, failing to complete tasks. Difficulty organizing tasks and activities. Avoidance or reluctance to engage in tasks requiring sustained mental effort. Losing things necessary for tasks, such as books, keys, or tools. Being easily distracted by extraneous stimuli. Forgetfulness in daily activities. Hyperactivity and impulsivity in ADHD. Fidgeting, tapping hands, or squirming in seats. Inability to stay seated in situations where remaining seated is expected. Running or climbing in inappropriate situations. Inability to play or engage in leisure activities quietly. Excessive talking or blurting out answers before questions are completed. Difficulty waiting one's turn. Interrupting or intruding on others' conversations or games. Types of ADHD. ADHD is classified into 3 primary subtypes depending on the symptoms. Predominantly inattentive presentation. Individuals show significant symptoms of inattention but fewer of hyperactivity impulsivity. This type is often referred to as a DD or attention deficit disorder. Predominantly hyperactive impulsive presentation. Symptoms of hyperactivity and impulsivity dominate, while inattention may be less prominent. This subtype is more noticeable in younger children. Combined presentation. Both inattention and hyperactivity impulsivity symptoms are present, which is the most common presentation of ADHD. Diagnosis of ADHD. ADHD diagnosis is typically made by a healthcare professional, often a psychiatrist or psychologist, following a comprehensive assessment. This assessment includes interviews with the patient and parents or teachers in the case of children, behavior rating scales or checklists, observation of the patient's behavior across multiple environments, such as home, school, or work, a detailed medical and developmental history to rule out other causes for the symptoms. There is no single test for ADHD. It is diagnosed based on clinical evaluation of symptom patterns, their duration, and their impact on daily functioning. Causes and risk factors of ADHD. While the exact cause of ADHD is unknown, several factors are thought to contribute to its development, including genetic factors. ADHD tends to run in families, suggesting a strong hereditary component. Certain genetic variations are believed to be involved in the regulation of dopamine, a neurotransmitter associated with attention and reward pathways in the brain. Environmental factors, exposure to toxins, prenatal exposure to alcohol or tobacco, premature birth, and low birth weight have all been linked to an increased risk of developing ADHD. Brain differences. Neuroimaging studies have shown that individuals with ADHD may have differences in the structure and function of brain areas involved in attention, impulse control, and executive functioning, particularly in the prefrontal cortex. Treatment approaches. ADHD is typically treated with a combination of behavioral therapies and, in some cases, medication. Treatment strategies vary depending on the severity of symptoms, age of the patient, and the specific challenges faced by the individual. Medications for ADHD. Stimulants. These are the most common medications prescribed for ADHD and are effective in about 70–80% of cases. Stimulants increase dopamine and norepinephrine levels in the brain, improving focus and reducing impulsivity and hyperactivity. Non-stimulant medications. These may be used when stimulants are ineffective or cause undesirable side effects. Behavioral therapies. Cognitive behavioral therapy (CBT). This helps individuals with ADHD develop better organizational skills, improve time management, and change negative thought patterns that interfere with productivity. Parent training. For children with ADHD, training parents in behavior management strategies can significantly improve outcomes. Social skills training. This helps individuals with ADHD learn appropriate social behaviors, improving relationships with peers and family members. Educational support. Many children with ADHD benefit from accommodations at school, such as extended time on tests, breaks during class, or the use of assistive technology to help with organization and focus. Lifestyle interventions. A balanced diet, regular physical activity, and adequate sleep can help manage symptoms. Additionally, mindfulness practices have shown some promise in improving attention and reducing stress. Living with ADHD. Though ADHD can present significant challenges, especially in environments that demand sustained focus and organization, many individuals with ADHD can thrive with the right interventions. Adults with ADHD may benefit from work environments that allow flexibility and creativity. Many individuals with ADHD are known for their creativity, energy, and ability to think outside the box, which can be an asset in certain fields. Support groups and advocacy organizations also provide resources for those with ADHD and their families. Understanding and addressing the disorder as early as possible can help improve outcomes and quality of life.